It's a real pleasure to introduce Dr. Noshene Ranjbar. Dr. Ranjbar was born and raised in Tehran, Iran, until immigrating to the US in adolescence. And I think it's important to describe some of her life's journey to provide some context for her talk today. Throughout her studies and life experiences, including her own illness, caring for her mother who suffered from several autoimmune illnesses and cancer, to fostering refugee children with PTSD, to most recently working with American Indian communities across the US, she's developed a keen interest in approaches to healing trauma and advocating for holistic mental health in empowering and culturally appropriate ways. Dr. Ranjbar completed undergraduate and medical school at the University of Virginia, her psychiatry residency at the University of Arizona in Tucson, and child and adolescent psychiatry fellowship at Boston Children's. She is board certified in general psychiatry, child and adolescent psychiatry, and integrative medicine, and she serves as associate clinical professor of psychiatry and director of the integrative psychiatry program at the University of Arizona. She also serves on faculty with the Center for Mind-Body Medicine, the Andrew Weil Center for Integrative Medicine, and the Integrative Psychiatry Institute. Dr. Ranjbar's work focuses on training the next generation of psychiatrists, and I'd say other physicians and students and other learners, to offer a holistic approach to mental health while also serving children and families most in need. As a Robert Wood Johnson Culture of Health leader, she is expanding her work in integrative mental health and indigenous mental health nationally and internationally. I want to remind everyone that this is a College of Medicine Spark lecture and is eligible for 1 DEI credit, and instructions to claim this credit will be posted at the end of Dr. Ranjbar's lecture. So please join me in welcoming Dr. Ranjbar, and I will turn things over to her.
Thank you so much, Dr. Karp, and thank you all for coming to this presentation and hearing my sharing from the heart on a topic that has, I would say, transformed me personally and professionally for the past 15 years or so. And I would like to also honor my co-presenter, Emily Shotine Allerton, who is out sick, sadly, and she is here with us at the presentation and has shared some welcome remarks in the chat and will be, hopefully, if she's feeling well enough, participating in the chat as much as she's able to throughout the presentation. So before we more fully begin, I want to use this opportunity to offer a mind-body practice, which we'll learn a lot more about over the next 45 minutes or so. But please join me in just a few moments of centering and grounding yourself, your own mind and thoughts and breath and body. As I find a practice like this to begin any patient interaction, any meeting, any session, super helpful for my own anxiety, but also just to bring us to this present moment and hopefully with a better focus and better intention. So I invite you for just a moment to notice where you're sitting or standing. Notice your feet, perhaps on the floor, on the ground, in touch with the earth underneath. Notice the parts of your body that are in contact with the chair, with the back of the chair. This kind of attention to our connection to the earth underneath can be an opportunity to reconnect with our own sense of belonging, groundedness, strength. And I want to acknowledge that the land that I find myself sitting on in this moment is a land that was cared for, honored by, taken care of, played on, preyed on, worked on, loved by the Atam and the Yaqui people. So I invite you, as you notice where you are in this moment, to perhaps take a moment and honor those who've come before you where you are. And you're welcome to share that in the chat if you wish, or just keep it within your own awareness. Being reminded of our ancestors, our teachers, our mentors, those who have influenced and shaped who we are today. And then I invite you to bring attention for a few moments to your breath, this other aspect of life that is with us from the moment we come into this world through every life experience, all the way to the final moment. And without judgment, without trying to make it perfect, bring attention and notice, perhaps with a sense of compassion, your own capacity to breathe in and out. Breath is something that connects us to all other living beings, to each other, to the four-leggeds, to the birds flying in the sky, and really to all of nature. One of the many ways to breathe, which can be particularly calming, is to take a few moments and breathe in through the nostrils and out through the mouth. So if you'd like to do that for a few moments, allow your belly to rise and fall with each breath in and out. And recognizing that each time we breathe in this way, with a soft belly breath, we actually activate the vagus nerve as it travels through the diaphragm, the breathing muscle, and allows for calming, relaxing molecules to be shared with all the cells of our body through the bloodstream. So as simple as it is, the breath is probably one of the most powerful medicines that has ever existed. So I invite you for just a couple more moments to pay attention to your own capacity to reset, to rejuvenate, to replenish your energy. Then perhaps notice how your body feels as you do this over and over. And then gently, I invite you to bring your attention back to physical sensations, to your posture, to how you're holding your head and neck. And then gently allow the eyes to open if they were closed. And before you look at the screen, take a moment and notice what's around you. Colors, light, shapes, objects, sounds, even aromas or textures. And with that, I welcome you back to this presentation. As Dr. Karp kindly mentioned, my name is Noshene Ranjbar, and here are my disclosures of my work with the Center for Mind-Body Medicine, the Andrew Weil Center, and the Integrative Psychiatry Institute. Our learning objectives, as you may have already seen, are to appraise and explore ways in which mind-body medicine bridges modern science with wisdom of indigenous people that have been around for thousands of years, describe innovative implementation of mind-body medicine within the American Indian Youth Energy and Mental Health Balance, AYEM-B Camp in a Box program, as well as the Robert Wood Johnson Empowering All Relatives to Heal Earth efforts. And finally, to review some lessons learned regarding culturally congruent, trauma-informed program development in working with Indigenous communities. And I invite you to be aware of any questions or comments that come up, and we'll make sure to try to address them at the end. So, American Indian communities have been strong, resilient, and survived many really difficult and honestly horrendous things around along the history of humankind. In the US, there are currently 574 diverse, federally recognized sovereign tribes, nations, and villages. That does not include groups that do not currently have federal status or have been terminated. There are 22 recognized communities in Arizona, and each of these 574 plus communities have their own rich ethnicity, cultural, linguistic diversity, and tremendous resilience. Some of the sources of resiliency within these communities include their shared values and spiritual beliefs, their strong sense of personal responsibility for greater good of their community and the environment that they live in, their ceremonies and rituals, the community structure, which includes many gatherings and honorings and ways to respect both nature and also humans, particularly the elders. Traditional nutritional values and practices that have helped them stay resilient and survive. Stories, the power of art within song, dance, and storytelling. Shared unique understanding of environment based on language. Many sources of these resiliency, many of these resiliency sources were once criminalized, unfortunately, here within the US, and lost and still being threatened. There was a considerable number of decades during which most Native people were not allowed to practice their religions, their ceremonies, or their rituals. And the communities are now working very hard to instate a lot of these cultural practices that have gone unused or unrecognized or hidden for a long time. So community empowerment is needed to uplift and strengthen these sources of resiliency, to promote health and well-being. And in parallel, those of us providing services to these communities need to focus on trauma-informed and culturally congruent care that really empowers and brings in their needs and their voices and works for them. Some of the challenges that these precious communities have struggled with are particularly within the mental health realm. There has been often limited mental health care access, or even if there was mental health care access, limited culturally congruent healthcare access. High risks of trauma-related illnesses, substance use, and suicide, socioeconomic disparities, historical trauma, which have affected the mental health of these communities. Some of the contributing factors include historical and intergenerational trauma, ongoing trauma rates and exposures, proximity to toxic mine tailings, other environmental exposures, food deserts, isolation and poor access to nutrient-rich foods, poor access to healthcare, especially mental health care, and well-founded distrust of the scientific community, medical research, and the Indian Health Services, as well as many other structures within our society. And then we've had the COVID-19 pandemic, which has impacted these communities disproportionately with higher mortality rates from the pandemic, the virus itself, rapid loss of many elders who are knowledge bearers of culture and language, communal and individual PTSD, and economic impact. And that brings us to the field of mind-body medicine and how that has interconnected or interfaced with these communities over the past 15 to 20 years. So mind-body medicine, in definition, is medicine that focuses on interaction among the brain, the body, the mind, and behavior and environment, and powerful ways in which emotional, mental, social, spiritual, and behavioral factors can directly impact health. It regards as fundamental an approach that respects and enhances each person's and the community's capacity for self-knowledge and self-care. It emphasizes techniques that are grounded in this approach. That's from the National Center for Complementary and Integrative Health. And mind-body medicine seeks to provide these capacity-building techniques through trauma-informed, evidence-based, culturally flexible, community-focused modes that hopefully will continue to be of use and benefit to all of our communities. Some of the skills that are considered under the umbrella of mind-body medicine include things like the utilization of guided imagery, a number of forms of meditation, mindfulness practices, bringing awareness to one's family history and strengths as well as vulnerabilities and struggles within one's genealogy. Use of breath awareness, and regulation as a way to calm down the autonomic nervous system. Self-defined, personalized spirituality, taking the focus or encouraging focus on a sense of meaning and purpose for people to find their own way of bringing meaning to their life experiences. Utilization of group support, emotional awareness and expression in healthy ways. Utilization of various forms of ceremony and ritual that can be individualized for different people and different communities. Utilization of autogenics and biofeedback, body awareness, use of arts, including drawing and other expressive arts and writing, contemplative movement, as well as bringing awareness to a healthful and mindful relationship with food and eating. The Center for Mind-Body Medicine, through which most of my work has been with the field of mind-body medicine, has its own set of research studies that have been done mostly either with the Veterans Administration here in the US or with abroad in Kosovo and Gaza, as well as with some adolescents with depression. But three particular landmark studies included the first randomized controlled trial of any intervention with war-traumatized children that was in Gaza, which demonstrated a greater than 80% reduction in those qualifying with a diagnosis of PTSD, as well as additional studies, as I mentioned, with US veterans with combat-related PTSD and significant improvement in PTSD scores. However, the field of mind-body medicine research is quite immense and includes studies showing various techniques utilized within mind-body medicine, showing a boost of immune function, resiliency, improved attention and focus, bringing a sense of community and individual empowerment, increasing productivity, executive functioning, self-regulation abilities, emotional intelligence levels and relationship improvement, goal setting improvement, and in general, being a creative way to spark energy, enthusiasm, vision, and purpose for people. And one thing that is interesting about how mind-body medicine can be offered or utilized with indigenous communities is that because of the vast array of techniques that can be utilized, as well as the flexibility to adapt these techniques and offerings to various people in different cultures, it has been offered as a possibility of something that can be useful. And so there are shared elements between Native community, indigenous traditions, and various elements of mind-body medicine. Some of those being encouragement and honoring of how important it is to be fully present and mindful, encouragement of supporting one's community and feeling a sense of belonging and connection with others, bringing focus to moment-to-moment awareness that goes along with mindfulness, the importance of movement. Most tribal communities and indigenous people, all of us really in our ancestry, we're moving all the time. And so our more sedentary lifestyle has been very much a modern development that has unfortunately contributed to a lot of chronic disease and ailment and problems. Creative forms of self-expression through music and movement and art and stories and various forms of expression, and rituals and ceremonies. So given that a holistic integrative approach is needed to serve as a potential healthcare interface with indigenous communities, the interest in mind-body medicine and offering it as a possibility has been around for a while. And it has the potential pathway to provide a community-focused, empowering model of holistic care. And because our wellness models need to extend focus, reach to address determinants of social determinants of health and adverse childhood outcomes and metabolic disorders, again, the connection of mind-body medicine science and education and need for empowerment all kind of makes sense. I will talk more about the Oglala Women's Healing Circle and mind-body medicine later, but it's one example of where Native people have received training and through mind-body medicine and then made it their own by bringing it to their own community in a time of need. So my work with mind-body medicine, actually with the Center for Mind-Body Medicine, actually began as a second-year psychiatry resident here at the University of Arizona in Tucson. I happen to have a mentor and supervisor as one of my second-year mentors and supervisors in residency who had also gone through these trainings and suggested it to me. And I happened to go to one of the trainings and learn about how to deal with my own burnout and my own social, emotional healing needs as a physician. And then later was introduced to a team that were actually invited to the Pine Ridge Reservation to offer some of these skills as volunteers at shelters and schools and community centers and churches back in 2011. But even before that, the Center for Mind-Body Medicine had some of their faculty invited to some of the Alaskan tribal communities to offer some volunteer workshops. So my involvement started in 2011 when a Lakota elder invited our newly created team to begin to offer some workshops in the Pine Ridge Reservation in South Dakota. And that led to a continued building of trust and relationships with the community in Pine Ridge. And then in 2015, when there was a suicide epidemic that happened in Pine Ridge, we were invited to apply for an Administration for Native American Affairs, ANA federal grant that was actually awarded to one of the Pine Ridge schools, and it ended up helping train about 300 teachers and counselors within 7 tribal schools on the Pine Ridge Reservation. And then that led to several other grants and opportunities to bring the work to Minnesota and Wisconsin. And then in 2015, when I moved back to the University of Arizona, Tucson, after my fellowship in child psychiatry in Boston, we began to work more within the Arizona community, which continues to expand. These are some of the early communities that the mind-body programs were offered to, either through grants or through volunteer efforts. And this is the Pine Ridge Suicide Prevention Program that I mentioned. The grant through the ANA was actually offered as a community service grant to the Little Wound School, which ended up providing the trainings over a 3-year process to about 2,085 children and adults over that 3 years. But they continue to integrate the skills and the programming by a group of leaders that have been trained in Pine Ridge now into their own curricula for K through 5 at 7 tribal schools. The first 2 Native American women who became official faculty with the Center for Mind-Body Medicine, which is a 501(c)(3) nonprofit organization, were these 2 beloved elders, Donna LaChapelle, who's Ojibwe Dakota, and Elder Linda Eagle Speaker from the Blood Tribe of South Alberta and Blackfeet Tribe of Montana. And they, at the time, back in 2017 or 18, were elders in residence at the Minnesota Indian Women's Resource Center in Minneapolis, working with the homeless, sex trafficking shelters. And now Donna LaChapelle continues to work at the Native American Community Clinic, where this work is expanding and being utilized by therapists and other service providers. And Linda continues to provide cultural advisory and workshops and trainings in some of these techniques for her community as well. Collaborations here in Arizona began with the Tohono O'odham Nation, where I was serving as one of the psychiatrists through a contract, with the Intermountain Center for Human Development and the University of Arizona Department of Psychiatry as one of their child and adolescent and adult psychiatrists who was going out to cells on a monthly basis with medical students and child and adolescent psychiatry fellows to provide services to the Tohono O'odham Nation children and adults. And that began some relationships, and we were invited to present some mind-body skills workshops for the staff that worked at the Intermountain Center. And then through connections with lead psychiatrist there, Dr. Scott Farrell, and connection to the Lovell Foundation, a grant proposal was written and honored back in 2021, which set the stage for what is now called the Indigenous Initiative at the Center for Mind-Body Medicine. Expanded to a 3-year program nationally. The Tohono O'odham Behavioral Health Collaboration continues with multiple members of their administrative staff, counselors, and psychologists going through the trainings, as well as multiple teachers and counselors from the Babaquiveri Unified School District who are bringing the skills they're learning to the teenagers and other school children and teachers and community that they serve. Other Arizona tribal community collaborations have included presentations and offerings at the Winslow Annual Wellness Center, the Wallapai Health Education and Wellness Community Warrior Spirit Conferences in Gila River, Wonder Rock, and Kumeyaay in San Diego, as well as through the Association of American Indian Affairs repatriation conferences and the Pasquayaqui Tribe Behavioral Health, which I'll share more about. That brings us to the fabulous American Indian Youth Wellness Initiative that has been around with the Department of Family and Community Medicine for many, many years, something like more than 20 years, and is currently led by Dr. Francine Gachupin, who's Associate Professor in the Department of Community and Family Medicine here at the University of Arizona College of Medicine, and one of the co-authors in the recent book that was published on indigenous public health. And the camp itself, which serves Native youth, particularly at risk for diabetes and metabolic disorders, has been around since 1991, rooted in American Indian culture, teaching youth about their own rich traditions from the communities that they represent, addressing these challenges in cultural congruent manners. And then in 2020, right in the midst of the pandemic, Dr. Gachupin, together with a group of colleagues, were granted an IMH grant to study this camp and its outcomes in incorporating parenting, skills training, nutritional skills training, physical activity, as well as mind-body medicine programming as part of the offerings of the camp. And even though the initial grant proposal was written for what used to be always an in-person live camp in Prescott at one of the wonderful camp centers, the team had to pivot to shift that camp from an in-person camp to what is now called Camp in a Box to meet the needs during the COVID-19 pandemic. And basically this, I will focus on the mind-body medicine components of the camp, since that is the part that I had a role, a significant role in. And the mind-body medicine component was really designed to help address the impact of stress on mind, body, and emotions of these youth and their families, engender resiliency and empowerment, aid in understanding connections between their mind, body, and behavior patterns, support lifestyle behavior change, and mobilize a wide range of abilities. And we had various sessions, both before the pandemic and in-person type activities in various mind-body skills, but also after the pandemic started, we tried to move all of those skill building sessions to either worksheets and boxes that each family and set of youth were sent on a weekly basis to learn about and practice some of these techniques on their own, as well as a series of videos that were created to help facilitate for those who had access to internet. So this is some fun photos of the Camp in a Box program that the staff of Camp in a Box and Dr. Gachupin and many students and helpers would put together every week and send to families all across Arizona, and some photos of children actually doing some of the worksheets and making art and planting plants and doing different activities and taking photos and sharing with the camp staff. The Mind-Body Camp supplies that we sent to the youth and their families included things like journals and pens and crayons and biosquares or mood rings, wind chimes, mindfulness book, and a meaning pouch. And the worksheets and activities included descriptions of each of the activities and instructions of how to do each of these activities. The very first year, 2020, right during the pandemic, we were also able to have 8 weekly Zoom meetings that were open to parents of the youth to be able to participate and learn about some of the skills so that they could help facilitate both for their own self-care, but to help their youth be able to understand and follow the directions perhaps even better. There were many issues with internet and the ability of the parents to participate in these weekly sessions, but we had somewhere between 3 and 4 parents on average be able to attend. And at that time, 14 families participated. and were able to take advantage of some of the Camp in a Box offerings. Some of the comments that they gave us were that they liked mindful eating sessions. Kids don't usually take their time with food and they eat really fast, so it was good to make them aware of the importance of eating more mindfully. We plan to do more meditation sessions and make it part of our weekly activities for the family. Kids are more aware of intensity of exercise now because of the various booster sessions that were offered. And one of the feedback remarks that we received from the tribal leadership and community leaders were that the synchronous Zoom meetings were not really working very well. So they asked that for 2021, we make all of our programming in a way that it was not contingent on internet access and have more of an asynchronous curriculum. And also as a result of the learnings and what we took away from 2020, we were able to put together this paper that went into more details of the ways that the Camp in a Box was set up and things that we learned from the feedback that we received. Then in Camp in a Box 2021, because of the continuation of the pandemic and inability to switch to in-person, switch back to in-person camp, we proceeded in making 14 about 15 to 30 minute videos, and to try to make those available for any of the youth and families who, were able to get the internet access and be able to watch them, to have the videos as a additional opportunity to learn in addition to the worksheets and the materials that the children would get in the boxes on a weekly basis. And so we invited a variety of individuals who had gone through and been certified through the Center for Mind-Body Medicine, the majority of which were Native American Indian community members from all around the US. And we invited them to each create a video or two on a topic within the mind-body medicine topics. And so that curriculum development focused on the mind-body medicine techniques and science, as well as delivering the material in a trauma-informed and culturally congruent way. And they were all adapted and based on the standardized curriculum that is part of the Center for Mind-Body Medicine curriculum for children and adolescents. Here are 6 of the presenters for the videos. Bim Poirier from the Pine Ridge Reservation, Edwina Brown Bull, also from the Pine Ridge Reservation, Ali Badhart Bull, Pine Ridge, Linda Eagle Speaker, who lived in Minnesota at the time, Dennis Yellow Thunder, also in Pine Ridge, and Joanne Reichert, Dr. Reichert from the White Earth Ojibwe Reservation. In Camp in a Box 2021, we had families participating in the research with 9 families and 18 total youth. And then we also had returning camp families that were not part of the research, but they were still able to participate since they had already been part of the program and were interested in taking part. Some of the challenges that continued on in 2021 were some technical difficulty challenges. For example, the videos were initially offered as just a brief link that the children would receive in the worksheets, and then they would have to put the links into the internet to get to the videos. But based on the feedback that we received, we were able to switch that to QR codes to be able to send those to them and to make that a little bit easier for them to access. There were challenges with shipment delays of supplies at times, and one of the feedback that we received from the families and community were that first week of the camp, which had Monday through Friday activities, was just too much and too intensive for the families and the youth. So they it was a lot to fit into a week worth of activities. Some of the feedback at 6 months after 2021 camp was, it comes right to our door. It's complete with all materials we need. We can work on projects as a family. It benefits everyone regardless of their age. It's also info that can be shared with extended family and friends, lifetime lessons, especially the mindfulness portion. Based on the feedback from 2021, we made some changes for 2022. The camp week activities were changed from 5 days in that week to 3 days, just Monday, Wednesday, and Friday. The technical issues were addressed as much as we could with switching the QR codes, and the team worked hard on getting the supplies delivered ahead of time to address any issues with shipping delays. This time we had an NF6 for the families participating, and some of the challenges that they shared about were difficulty finding time to watch the videos, difficulty with length of some of the interviews that they participated in with research staff, and parents asking for more information on common diseases and lists of restaurants with healthy eating choices that they could focus on taking the children to. So in our hopes for continuing to 2023, which is the final year of the AYEM-B and IMH grant, is to try to have an in-person camp back in Prescott, working to increase family enrollment. Hopefully, if the pandemic continues to allow for in-person activities as that is beginning to be possible, developing more materials and resources on topics of interests that the families have shared with us, continuing to build trust-centered relationships with these communities. And if we're not able to have an in-person camp, consider additional changes to the videos, either making them shorter or animating them or somehow making them more fun and accessible for the families. The evaluations that we continue to offer to the families are at pre-camp, midpoint, and post. And for the mind-body component, those include the depression and anxiety scale for the parents, as well as the Sterling Children's Wellbeing Survey. Some of the lessons that we've learned along this implementation path is that really cultural humility and flexibility on part of researchers and administrators of the program is essential. Importance of flexibility with teamwork, planning, having to change plans because of something like a pandemic and many other unexpected staffing changes or illnesses, or especially during a time when the pandemic has impacted so many people's lives, particularly the tribes, and ongoing collaboration with tribal organizations, community leaders, and at the same time, the pandemic really led to innovative ways to address access in remote communities. So the possibility of practicing creating these recorded lectures or the recorded videos, the virtual groups offerings to the parents, internet resources, mail outs, those camps in a box, having children work with their parents and families as a unit, because in the past when they would come to the in-person camp, it was just the children. And so a lot of times the parents didn't really know all of that things that children learned at the camp. So this allowed for a lot of the activities to be more family centered and actually help the parents have more of a sense of what the kids were being exposed to, learning, and trying to practice as far as health promoting skills. And the strengths of Camp in a Box model continues to be providing the wellness education delivery in as a culturally relevant, child and family friendly manner as possible at this time. Strength is found in tribal partnerships, culturally congruent materials developed and led by Native community members. Challenges around aligning Western research methodologies and time sensitivity and reporting needs with various cultural needs, especially during the pandemic, IRB change approval processes that can take time when there is new staff or changes in various aspects of the protocols, adapting as we receive feedback from the tribal leadership or there are changes, and respecting the time of the participants to not overdoing the surveys and evaluations and interviews and really helping them feel excited about supporting their own healthy behaviors. Here's a list of some of the medical students and residents and now attendings who have participated in various aspects of Camp in a Box or AYEM-B or other mind-body programming. And that brings me just in the last couple of minutes that we have left to talk about the Robert Wood Johnson Earth Initiative, which is really an opportunity to build off of all the training that has been happening both in Arizona and nationally through the Center for Mind-Body Medicine to support Native community empowerment and trauma healing. And so, as I had mentioned earlier, the Level Foundation had supported a grant to the Center for Mind-Body Medicine in 2021 as a seed grant to help train about 20 tribal leaders and community healthcare providers and medical students and physicians or nurses or teachers who were interested within Arizona to go through the trainings and actually get certified in providing mind-body skills groups and workshops. And so we were able to get additional donations and volunteering to have that grant to actually be able to produce 60 trained people from all over the US instead of the 20 that were promised as part of the grant. And here are some of these folks from the Pasquayaqui Tribe Wellness Conference Center. This was a group for nurses right during the pandemic that was led by two of the behavioral health staff at the Pasquayaqui Centered Spirit program. But that allowed us to end up being able to apply and receive a 3-year expanded funding for a national program for offering these trainings for various communities. And so up until this moment that we're just into the first year of this, what is called the Indigenous Initiative, here are some examples of folks who've gone through the trainings and have offered groups and workshops and trainings within their communities, everywhere from the Native Women's Society of the Great Plains to the Pasquayaqui Fire Department to the 7th Gathering of Healthy Relations and Statewide Hybrid Conference here in Arizona, to Wellness Wednesdays at the Guadalupe GED program, to programs in Manhattan for solidarity and missing and murdered Indigenous women and relatives, to programs in Connecticut with the Spotted Turtle Wellness Training and the Vocational Rehabilitation Program. These are just some examples, but we have about 23 tribal communities represented in these trainings that are now part of what's called the Indigenous Initiative. It was built as an expansion from that 2021 seed grant from the Level Foundation. It was supported by the Novo Foundation, Level Foundation, and Wayfarer Foundation. And it is a 3-year proposal that goes through 2025, and fundraising efforts continue. The Robert Wood Johnson strategic initiative, which dovetails on this Indigenous initiative, is to actually give voice to stories from these various individuals who have gone through these trainings through a fully funded scholarship and are now doing incredible work bringing their skills into their communities, whether they work within the school system or in shelters or in other community settings. And so the Robert Wood Johnson Grant Initiative started in 2020 and goes through 2023. And it's basically inviting participants in these trainings to tell their stories and utilize that as a way to both bring attention, networking, and fundraising to the needs that those communities have, but also to be able to provide ongoing support and expansion of the offerings that they are promoting. And so what we do is we have a journalist, storyteller, writing expert who meets with each of the individuals who are interested in telling their story and shares, helps them tell their story either in video format or in written format or as a poem, and then allows them to share that in however way they wish to bring attention to the needs of their community or further support promotion of what their community needs. And so it utilizes storytelling and community-based efforts, as well as the various resources and relationships that are in place through these various organizations. And so we have a Facebook group, a private Facebook group that includes 123 of these amazing people who are constantly networking and sharing their learnings and their struggles and what's happening in their communities as they bring this work. And then as they offer workshops or groups, they are invited if they wish to be part of the storytelling campaign. As well as linking them to other services and happenings in their communities, such as a plant medicine presentation or domestic violence training or other things that might be going that they can share across communities. I'm just going to skip through this and share with you, and it's all of the activities are under the direction of cultural advisors and elders, and each of the storytellers gets to shape their story themselves and decide if they are wanting to share it or what version of it they would like to share and with who. And I'm going to end with some examples of the stories. So I realized when we were launching this project that it was not fair to invite people to share their stories without doing a guinea pig version of it myself. So it just so happened that we were right in the midst of some of the unrest that's happening in my origin country of Iran. So I utilized that opportunity to share a version of my story. And then here are examples of other stories that have been shared, just very brief. Most of the stories are about 700 to 1,000 words, and then various small snippets of them are shared here on these slides. Liliana is from an indigenous community in Colombia. Cynthia is in Pine Ridge Reservation as a kindergarten teacher. Tanya is an elder who lives in Connecticut and has been part of the Lakota community and blessings for a long time. Egla is indigenous Mexican. And I want to end by giving gratitude for our cultural advisors and elders, Alta, Ken, Linda, and Donna, and honoring the NIMH grant that the AYEM-B is part of, as well as some references. So I'm going to end with that and open it up for questions or comments, and with gratitude for your attention and well wishes.
Thanks so much, Dr. Ranjbar. That was just great. And we have a couple of minutes for questions or discussion, and would love to have the audience participate. Feel free to either put it in the chat or unmute yourself, and please put yourself on video if you'd like to directly ask a question. Dr. Ranjbar, when you are in the clinic with somebody who identifies that they're open to integrative or mind-body medicine approaches, and incorporating that into their psychiatric care. How do you talk about that with your patients?
Thank you for that question. So I think the integrative psychiatry and or holistic mental health is really all about getting to know one's community and being able to help encourage referrals and connections when possible. So for example, if I have a Native person who is interested in connecting with a Native practitioner, I might use the Southern Arizona Providers Listserv and send a message on that and say, I have a Native patient who's looking for XYZ. Is there someone that, is available? Or I might connect them to the Tucson Indian Center, or some of my colleagues at the Pascoyaqui tribe, or the Ababaquiveri school district, or whatever, depending on what the need is for a healer or a ceremony or a cultural event or a therapist. But I think a lot of it is just being open and honoring and listening actively to what people need, and then doing our best to link them if we can, but certainly welcome their needs and interests and belief systems as part of the care. And it's not always easy, so we certainly do our best.
Thank you.
Say, Dr. Ranjbar, thank you so much. It's always wonderful to hear of how many inspiring programs are taking place, especially the ones that you mentioned that are so community driven, which is an enormous aspect of this work. And I wonder, even with the programs that are being done, what would you optimally wish for in terms of next steps, or where are the resources, where are the places that we aren't meeting the need or we can really improve?
There's so many. I guess I would say the schools are one of the highest places of need and resources, because there are never going to be enough trauma-informed, culturally congruent therapists and psychiatrists in the world to meet the needs. And so I think bringing training, skill-based educational programs to the community, the schools where people live and work, teaching the parents, teaching the students, teaching the teachers, that's where the needs are. And that comes down to funding. So, as we all know, the behavioral health funding is not always linked to educational school funding. And so I think we all need more innovative ways to work together as part of the various pots of funding and organization that removes barriers so that people can get what they need without having to be so sick that they, end up in a hospital or need a doctor at the crisis center. But that's a great question.
Well, on that note, which I think is an important note for us to end on, that we need to have more early interventions and trauma-informed and culturally congruent interventions in our schools. I want to thank Dr. Ranjbar for taking the time to prepare such an important talk today. To get your DEI credits, you can scan this QR code, or Jamie put a link in the chat. I know that Andy Bernstein requested the reference list, so maybe at 1:01, when people start to sign off, if you could put that back up, Noshene, and people can take a screenshot of that if you don't mind. And I'm sure that you're open to folks contacting you after if they want to talk more and learn more from you. Absolutely. But thank you so much for teaching us all today.
Thank you all. I'll put my email here.
Noshene, we had like 130 people today.
That's amazing.